Hello.
Hi. How are you doing, Mrs. Hirsch?
I'm good. How are you?
Thank you. My name is student Dr. Abrishami, and I'm going to be doing your visit today. What brings you in?
I have this pain on my legs.
Okay, where is the pain? Can you point at it?
On both legs, right over here.
Okay, and when did it start?
About 2 weeks ago.
Were you doing any activities, or it just happened out of nowhere?
Yeah, I was running.
Okay, so you're feeling the pain on this part of your leg, like the inner shin, and it started when you were running 2 weeks ago.
Yes.
Okay. Can you describe the pain for me?
It's a sharp shooting pain.
Sharp shooting pain. Okay. Is it constant or does it come and go?
It's constant while I'm running, but other than that, I don't really feel it.
Okay. And does it radiate down the leg?
No.
Okay. Does anything make it worse?
When I go on my tippy toes, it makes it worse, and when I'm running, it's the worst.
Okay. And then does anything make it better?
When I elevate my feet, it gets better.
Okay. Can you rank the pain from 1 to 10?
When I'm running, it's about an 8. It gets really bad. But right now, I would say it's about a 2.
Okay. So just to reiterate, you were running 2 weeks ago and you started to feel pain in the shin area on both of your legs, and it gets worse when you're running and on your tippy toes, and it gets better when you elevate it.
Yes.
Okay. And then now I'll just ask you a few questions about your past medical history. Have you ever been hospitalized or any surgeries?
No.
No? Okay. Any illnesses when you were a child or as an adult?
No.
What about your family?
My uncle has diabetes.
Okay. Any hypertension in the family?
My grandfather has hypertension.
Okay. Mother or father?
My father's side.
Okay. And are you taking any medications yourself?
I take Tylenol and some Advil to help with the pain.
Okay. Does it help?
A little bit, but not really.
Okay. And are you allergic to anything?
Nope.
Okay. Any blood transfusions?
Nope.
Okay. The patient is alert, aware, and oriented. Okay. Now I'll ask you a few questions about your social history. Are you working?
No, I'm a student right now.
Okay. Full-time student?
Yes.
Okay. Where do you go to school?
FAU.
Okay. Nice. What are you studying?
Nursing.
Nursing? Wow. Okay.
Yeah.
Perfect. And how's your sleep?
It's good. I get a solid 7 hours a night.
Okay. Are you exercising?
Yeah, I work out about 3 times a week.
Okay. Even right now with the injury, with the pain you're feeling?
Well, no, I haven't been doing any lower body workouts because of the pain is too much.
Okay. What's your diet like?
I have a clean diet.
Okay. And just a little personal question. Are you in a relationship?
Yeah.
Married or?
No, I just have a boyfriend.
Okay. Is it monogamous? Are you practicing safe sex?
Always safe.
Okay, good. And do you smoke?
No.
No, illicit drugs like marijuana?
No.
Okay.
No.
And do you drink?
Socially. I'll have a glass of wine, but that's it.
Okay. Do you have any pets?
Nope.
Okay. Have you traveled recently?
No, I'm just staying at home, always in Florida.
Okay. And how's your emotional state?
It's good. I've been good. Keeping, I'm getting good hours of sleep and eating well, and that's good.
Perfect. All right. Okay, now we're going to move to the lower extremity portion of the exam. Do you mind sitting back?
Sure. Perfect.
This part is the dermatological portion. I'm just going to check your skin and see if I see any lacerations, any maceration, papules, lesions. On the posterior part, it looks fine. Perfect. Okay. No macerations between your toes. Perfect. Okay, it's no dryness or scaliness. I do see a callus under your 5th metatarsal bilaterally. I also see some moles. Have they always been there?
Yeah, I've gotten them checked annually by my dermatologist. They've always been there.
And everything's been fine?
Yeah.
So you have nail polish, but doesn't look like there's any thickening. Do you have any toenail fungus or any yellowing or discoloration on your toes?
No.
Okay. Perfect. So, this portion is good. No macerations, no open lesions. We'll move on to the vascular portion now. I'm gonna check your pulses. Dorsalis pedis is good. Posterior tibialis, also good. Your popliteal, great. Great, all 2 out of 4, perfect. Check your elasticity, perfect. Capillary refill time, great, all under 3 seconds. I see some hair growth, that's perfect. Check your temperature. It's warm to warm, it's good. Skin texture is good, no dryness, no scaliness. I don't see any edema or pitting. No varicose veins. I'm going to check for DVT, which is deep vein thrombosis, with the Homan's test. I'm going to just flex your leg and dorsiflex your ankle and squeeze your calf. Great. Let's do the same thing on this side. Put yourself in neutral, dorsiflex, and squeeze. Perfect. Okay, everything looks good over there. Now we'll move into the musculoskeletal portion of the exam. I'm going to push towards you and you're going to push against me. Okay, so push out. Perfect. Push in. Nice. Push up. Okay, push down like the gas pedal. Perfect. And now we'll check your range of motion. First, we'll do your first metatarsal. Good range of motion. Perfect. Put your subtalar joint in neutral. Great. Great. Put your ankle in neutral, and then I'm going to check your dorsiflexion. Wow, it's great dorsiflexion.
Thank you.
Same on this side. This is a silver scoid test. I'm going to check your ankle range of motion now with your knee flexed. You have much more range of motion, dorsiflexion over there when your knee is flexed. Okay, everything looks great over here. Now we'll move to the next portion. Okay, Ms. Hirsch, now we're on the neurological portion of the exam. I'm going to use the Sims-Weinstein monofilament. This is the 10-point exam. So here, just give me your hand. You feel that feeling?
Yeah.
Okay. Whenever you feel it on your foot, just tell me yes.
Okay.
And just close your eyes.
Yes. Yes. Yep. Yes. 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 Yep.
Perfect. Okay. Now we're gonna do the vibratory discrimination part. Whenever you don't feel it anymore, just let me know.
Okay.
Okay.
No.
Perfect.
No. No. No.
Okay. Great. Okay, the next portion is going to be proprioception. Also with your eyes closed, just let me know if I'm moving your toe up or down and which toe.
Okay.
Okay?
Big toe up.
Perfect.
Middle toe down.
Okay.
Big toe down. Middle toe down. Small toe up.
Perfect. Okay. Next we'll do the Babinski portion of the exam. This is for your reflexes. Okay, perfect. Now we'll do the sharp and dull test. Just let me know if you feel a sharp feeling or a dull feeling.
Okay.
And just to show you, this is dull, this is sharp.
Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Perfect. Okay, and to check a couple more reflexes, I'm just going to have you sit further down. We're going to do the patellar reflex. Okay, I'm going to check your Achilles now. Okay, Ms. Hirsch, thank you so much for coming in. So after doing the lower extremity exam, I believe this is a medial tibial stress syndrome, which is also known as shin splints. This is really common in runners. Worst case scenario, it could be a tibial stress fracture or a chronic exertional compartment syndrome. But I want to order an x-ray and get some imaging so we can rule out the stress fracture or any other underlying conditions. I also want to watch you walk and run and analyze your gait, and this can also ID some abnormalities. What I do recommend in the meantime is one PT. I think that'll really support you. I recommend swimming, cycling, stretching. I can show you some stretches for like strengthening your tibialis anterior or toe taps and stretching your calves. You can do that on the wall. Foam rolling is also a great tool. We can also get you a brace or some like compression socks. This will decrease the strain and increase circulation. For the pain, I know you mentioned that you were taking Advil. I actually recommend you taking ibuprofen, which is an anti-inflammatory, and it decreases the pain, so it'll do both for you. I think the reason it hasn't been improving is just that Advil has been masking the pain and not decreasing the inflammation. What you are doing that is working, in my opinion, is you're elevating the leg, which is decreasing the swelling. So I would keep that up. Also include icing, 15 to 20 minutes a day, several times a day. That will also really help. So let's do the x-ray, let's do PT, let's rule out if it's a medial tibial stress syndrome or if it's a stress fracture or a compartment syndrome, and we'll go from there. Thank you so much for coming in. Do you have any questions for me?
No, thank you for your time and patience.
Thank you. Have a good day.
You too.